Welcome, everyone, to our patient education programme hosted by Hyperacusis International Specialist Clinics and Research Institute for Misophonia, Tinnitus and Hyperacusis. Hyperacusis International is a multidisciplinary organisation which aims to help you with assessment and management of your misophonia, tinnitus and hyperacusis. Each month we'll be exploring a different topic within sound sensitivity, aiming to give you a broader knowledge and understanding of these conditions. My name is Joanna Barker, and I'm your host for these sessions. I've been an audiologist for the last 12 years, and I'm a specialist in sound sensitivity. These are my passion, and I'm really excited to bring these live sessions to you. Today, we are kindly joined by Dr. Patrick Dwyer, who is a research fellow from the Olga, Tennison Autism Research Centre, School for Psychology and Public Health, at Trobe University, Australia. Patrick received his PhD in development psychology from the University of California and completed his BA in psychology at Canada's University of Victoria. Patrick's research is particularly focused on how autistic and neurodivergent people of all ages experience and attend to the world around them, including autistic experiences of sensory distress and discomfort. In addition, Patrick has a strong interest in important topical issues in the autism community, including the neurodiversity movement and the politics of intervention. He will be talking to us today about his latest research around sound intolerance and attention in neurodivergent populations, with a primary focus on autism and a secondary focus on ADHD. This presentation will discuss commonly observed neurodivergent attention patterns, such as hyperfocus, monotropism, and hypervigilance, and present data on how these may relate to experiences of sound intolerance as well as mental health challenges. There will be the opportunity to ask questions after the presentation, so please feel free to post these through the chat function. Thank you so much for joining us, Patrick. I will now hand over to you.
Oh, thank you for inviting me. Excited to talk with everybody here and share my research and perspectives. I can't remember in your kind introduction. I'm in the dreadful habit of just sort of assuming that everybody knows that I'm autistic, but and therefore sometimes leave it out of bios and things. But if you start hearing me talk in terms of like we for autistic or neurodivergent populations, that would be why. But yes, so you can see here, understanding autistic sound intolerance probably should be autistic and ADHD, because as was mentioned, there will be some ADHD data as well. But the primary focus of what I was going to talk to you today is indeed autism oriented. And before I dive into that, I will acknowledge that I am speaking to you today currently from the country of the Wurundjeri people of the Kulin Nation. And some of the work that I'm presenting to you as well was done as part of my PhD research, which was on the traditional territories of the Powin people. And I believe in both cases, those territories were never freely or voluntarily ceded. So I am grateful to have had the opportunity to work on both of those lands and countries, and my gratitude and respect to the indigenous nations concerned, whose countries those are. And just to begin, I imagine people probably have a general idea of what autism is, neurodevelopmental diagnostic category where you've got some social and communication aspects, but also this whole domain of non-social things, which actually are somewhat loosely related to each other. Like, for example, people may have some repetitive motor movements, some stimming, motor, vocal, whatever. People may have very intense interests, a point that will be relevant later, or have difficulty coping with sort of uncertainty and not having, a control or a say in one's environment, as well as sensory issues. And think about the sensory issues, they're happening inside the privacy of the autistic person's own, brain, their own experiences. They're not necessarily apparent to other people. And autism, as you can see on the slide there, it was first described by various people over the period of like the 1920s to the 1940s or so. And then we have a good half century or so between then and the emergence of communities of autistic people. So there were autistic people before then, and they were getting diagnosed. But if they were being gathered together in one place, it was generally at the initiative of non-autistic people, or at least people who believe themselves to be non-autistic, perhaps for like some therapeutic purpose, or even in awful institutional settings. And it was not really until the 1990s that you started to see autistic people actually gathering together in their own communities, and sharing their own perspectives. And so, whilst the autistic people were sort of left out of the narrative, not having a say in things like an internal experience that is most salient to the person having that experience are relatively left out. And people in these communities realized that they needed to make sense of these sensory experiences to figure out what was going on, and we're trying to actually develop a language to do this, which kind of relates to a philosophical concept of epistemic justice, that without actually having the language to make sense of your experiences, let alone convey them to other people, that's quite an issue. Um, and so, for example, Ben Bellick has written about the importance of these efforts to try and develop or appropriate terms to describe autistic experiences. And so some of these terms, for example, include, sensory overwhelm or overload, which is, yes, of course, talked about in other communities besides autism. But was used by autistic people to understand this experience of just being unable to think or process or function, in the world while you're bombarded by these overwhelming sensory inputs, that could result in, for example, a state of shutdown where, as a result of that sort of loss of, coping and functioning and, and processing, people might enter almost a dissociated state and really struggle to engage with the world or communicate with other people about what's going on while they're in that overwhelmed state, or even a meltdown where people are losing volitional control of their behavior and getting dysregulated in ways that could actually get somebody in a lot of trouble. And coping with all this stuff, as well as the other stresses that come with being autistic or neurodivergent, were leading people to develop burnout, where every day there's so many issues that just make it so hard to function in the world, that you're getting exhausted and burnt out. And once you're burnt out, you have less coping resources. And so people have said in qualitative studies that this results in a further loss of ability to tolerate sensory stimulation, which I'm fairly sure is true based on what happened to me in middle school. So that's one way of classifying these experiences. But there were other people who were also noticing that, among autistic folks and other people who were experiencing these sorts of sensory issues, that there was this unmet gap where they were not receiving support. And the occupational therapists were really crucial here in recognizing these gaps and trying to do something about it. And so you see frameworks like this one, which sort of underpins the sensory profile, very commonly used instrument. It's not 100% perfect. There are some issues here. You see that you've got sort of these two dimensions that people respond to, the idea is to try and counteract the threshold or in accordance with the threshold. And what is the threshold, you might ask? Well, the idea that it reflects your sort of um, ability to be detecting and aware of sensory stimulation. And uh, this is tricky because although this is saying that these experiences of like hyper responding or under responding, hypo responding are fundamentally related to the thresholds. We know, in fact, that autistic people tend to have often quite normal thresholds, average thresholds. So, for example, if you're thinking about acuity, to detect, a really soft sound in a controlled environment with nothing else happening. Generally pretty much the same across autistic and non-autistic people. I mean, of course, some autistic people and some non-autistic people will have some sort of hearing loss or deafness, but not necessarily to a greatly different degree. Same for detecting subtle differences in sound. There might be some subgroups of people with better pitch perception or differences in tactile thresholds or things, but really not all that different. And compared to the vastly greater numbers of autistic people who are experiencing sensory overwhelm and things, it doesn't seem like these are in fact the same thing. It's also tricky because here this is saying there's one dimension of higher to lower sensory responding, right? You're under responsive or you're over responsive, and we see actually that these run together in an almost paradoxical way. You are more over responsive to sensory input, you tend to be more under responsive to sensory input as well. That's true in both autistic people and non-autistic people, in our data and in many, many other people's data. It sounds contradictory, but it's not. It could be not exactly the same stimulus, but different stimuli, different contexts. So more recent, frameworks have modified this a little, now conceptualizing hyper and hypo responsiveness as a couple of different dimensions where, most people, if they have more of one than the other, if they have more of one, will also tend to have more of the other, though, you can see some differences here, like this person is very hypo responsive and pretty hyper responsive, whereas this person is pretty hyper responsive but not quite as hypo responsive. But in general, they're separate dimensions, related but distinct. And enhanced perception, this sort of acuity to detect or at least be aware of stimuli is separate from hyper and hypo responsiveness. And then you've got the sensory interests, the sensory seeking is yet another dimension. So that's from, again, frameworks that I especially associate with the occupational therapists. But of course, this is still pretty coarse, right, in terms of saying that everything is sensory hyperresponsiveness. And I'm sure this audience would agree that you've got some very distinct kinds of sensory hyperresponsiveness that are not the same thing. Like, for example, misophonia, which I'm sure people here would be familiar with as referring to these more emotional reactions like anger or disgust or frustration, potentially high levels of frustration towards certain sounds that are really triggering, obnoxious, annoying, not necessarily loud sounds. They could be loud, but even if they're soft, you could still have this emotional reaction if you're able to detect and discern and identify the sound. Which is quite different, of course, from hyperacusis, which you could see as being much more closely related to loudness, right? That there is an aversion where you are experiencing some sound that other people would not consider loud as uncomfortably loud, perhaps even experiencing pain as a result of that sound. So those seem like much more concrete things. But then if we circle back to the sensory overload category, that's actually been defined, and people have said, well, it refers to being overwhelmed by the intensity of stimuli. Intensity, that would include volume, that would include things like, therefore, hyperacusis, potentially, as being potentially something that's on its own and separate, but it could also be a manifestation of this broader sensory overload pattern, right? So it's very confusing. And you could also be overwhelmed by the number of stimuli, so the number of things bombarding you at once, but you could be overwhelmed by the pattern of the stimulus. The pattern of the stimulus, the type of stimulation you're getting could be overwhelming. And one wonders, could that be something like misophonia, where it is really the pattern of the sound that is driving this emotional reaction? And so this is therefore, seeming to be like a much more global construct. It's not even specific to hearing, but it seems to include aspects of these experiences. And we do know that if you've got hyperacusis, you're more likely to have misophonia. So it may not be entirely unreasonable to suggest that some people may have something more general like this underpinning both experiences, whereas in other people it may be that they have one or the other in a more specific way. So it's a big mess. And that's an issue because, as I mentioned earlier, you need to understand what's going on in your own head in order to, just have that sense of control and being able to sort of figure out what your own needs are, let alone trying to convey that to other people who aren't having this experience and who are not necessarily going to understand or accept this or validate this experience, may think you're just being difficult or something, let alone providing actual accommodations or support. So this is not a great situation that we've got, so little understanding of what's actually going on underlying all of this. And it does raise the question, maybe understanding some of the contributing factors to all of this could be helpful. And this is where we are going to get to the attention part that was promised at the beginning, that we would eventually get to talking about attention. And you may be thinking, oh, attention, that's so dull and boring. That's just like, somebody going around saying, pay attention, because that's how we tend to use the term. But really, I mean, attention, it's what determines the contents of our consciousness to a very large degree, what goes into our conscious awareness. It is kind of what determines our experience of the world in a way. And so attention, I will argue, is actually kind of important and potentially related to a lot of these sensory, and sensory processing sorts of things, perceptual. So in autism, we have this hypothesis, this theory of autism called monotropism. It was actually somewhat unusual among the autism theories in that it was actually developed by autistic people who are combining research and lived experience in that sense. And it's conceptualizing autism as fundamentally being characterized by a difference of attention, where autistic people have this tendency to focus very intensely, narrowly, hyper-focusing on certain internally motivated interests. And by extension, not focusing on other things, because attention is a finite resource. And if you're hyper-focused on some things and putting more attentional resources into that, that leaves less attentional resources for everything else. And so you can imagine this manifesting in lots of different things. I mentioned before, many autistic people have intense interests. I have intense interests in things like autism or sensory processing, which is somewhat helpful if you're a researcher in those areas. But you can also have an interest in something that's more like, exploring the sensory properties of an object, which has actually a very blurry distinction from, sensory seeking. And you can also see this occurring in what we sometimes call autistic inertia, the idea that, once you get into this sort of attentional, flow or set where you're really focused on one thing, it's then difficult to, get out of that and switch over to something else. It's sort of sluggish, and it's also difficult to get that flow going in the first place. So very focused when it's engaged, but sluggish to shift or get engaged in the first place is kind of the idea. Now that all sounds relatively coherent, I hope. I hope you would agree with me in saying that. But we also see that, like about half of all autistic people, more or less, also have ADHD. And in autism, we do see definitely many findings suggesting that autistic people can be quite susceptible to having attention captured, to distractibility in attention, having stimuli out in our environments grabbing our attention rather than our attention being directed in this hyper-focused, internally motivated way. Which sounds very, very contradictory, and it is kind of contradictory. But again, I mentioned that this hyper-focused sort of attentional state would only be if somebody is really interested, for example, potentially, and maybe the rest of the time attention is getting grabbed by things in the environment, and then perhaps hyper-focusing on those or perhaps, sort of wandering, who knows, as, these things are still being worked out. But we can see, in fact, that although it sounds like these things ought to be contradictory or opposites, they are related. If you are more hyper-focusing, more often showing this hyper-focused attentional pattern for things that are engaging and rewarding and motivating, you are more likely as well to be distractible and inattentive at other times. So you can see this is true in autistic people, in ADHD people, and in people who are neither autistic nor ADHD. And remember, I already showed you this interesting thing here, where if you are more sensory hyper responsive, you're more likely to be sensory hypo or under responsive as well. So I find this kind of interesting. Hyper focused, but also distractible. Hyper sensory responsive, but also under hyposensory responsive. Is there some relationship here that we're seeing these seemingly paradoxical things? It could well be that, as I mentioned, the attention maybe could be related to the sensory stuff. If you're intensely hyper focusing on a pleasant stimulus, then that could be sensory seeking, right? It could intensify that pleasant experience. Whereas if you're intensely, narrowly focusing on that, pleasant sensory stimulus, and then, I don't know, there's a sound in the background or, a tactile sensation, but you're in that attention tunnel, maybe you're less responsive to that new sensory stimulus because of that, and maybe that reduces your response to it, leads to some of this under responsivity, perhaps. And maybe, if you then have an experience where some stimulus in your environment that you're not necessarily interested in and that is actually aversive and unpleasant, if that grabs your attention and then you're having difficulty getting this pattern of intense focus that is sluggish to disengage away from that stimulus, then maybe that contributes to or exacerbates some of these experiences of hyper responsiveness, perhaps to a different degree, depending on what kind of experience, even. Like I mentioned earlier, that sometimes hyperacusis manifests with pain. I find it intuitively less compelling that you could have an experience of auditory pain as a result of attention than, for example, that your attention would make you more likely to have trouble filtering out and moving on from some really aversive, annoying misophonia trigger sound. So, maybe the degree to which it's attention versus other things contributing could differ even across some of these different sound tolerance conditions, was the thinking. So we were interested in looking at this relationship between the sensory stuff and the attention. This is actually in very young children, 2 and 3-year-olds. So they cannot describe their sensory experiences. We're relying on their parents' best guesses about what's going on in terms of the sensory responding. And then they're sitting down in front of an eye tracker here. And in one of the conditions in this task, you've got a thing that pops up on the screen, then it disappears, and so people can go straight over to the new thing without any sort of delay. Whereas here in this other condition, you've got that thing staying up on the screen the whole time. And remember, I was saying about this sort of sluggish attention, you would have to disengage your attention from this, shift away, unstick your attention in order to get over to the new thing. So this is, what we call sort of a sticky attention pattern, that you're slower to disengage. And prior research has reported that sticky attention pattern is actually more common in autistic than non-autistic people. We didn't replicate that, but our main interest was actually more in the individual differences anyway. So I'll skip straight to that. And so you can see here the relationships with some of these parent-reported sensory patterns. And the autistic folks are in gold here, and you can see that if you have more of this sticky attention pattern, you're slower to disengage your attention before shifting. Autistic people who had that pattern were more likely to be reported to show sensory hyper responsiveness. as well as sensory seeking, as well as this sort of enhanced perception, more acuity, more awareness of sensory stimuli, which potentially could mean that if you're having difficulty shifting away from some unpleasant sensory stimulus or slower to do so, that maybe makes that a worse experience. Whereas if it's a pleasant sensory stimulus, then you get to have a wonderful experience of, pleasurable sensory seeking. And the enhanced perception pattern is just a bit funky. Not quite sure what that represents. Now, that's one side of this. The other question is, well, you've successfully unstuck your attention. You're on this new novel thing that's just been presented to you. Are you going to go back to what you were looking at before? Are you going to stay on that novel thing and continue exploring the novelty? And we actually saw here, this was more of a post hoc thing. We weren't expecting to see this, but you can see here's where they're looking at the new thing. More of the autistic people are going back to look at the old thing. That's them in gold here, and then the non-autistic youngsters, toddlers in blue. And people who had more of this pattern, which we call sort of springy attention, the idea they're going back to what they were looking at before, they're showing more of this under responsiveness. They like briefly see the new thing, but they're not engaging with it, but they're going back. And so not continuing to respond to that, presumably, would be the idea there. We also saw that this was very much related to cognitive ability, and perhaps if people aren't engaging with novelty, that's hitting learning opportunities. Now, this is all speculative about the directionality. This is cross-sectional data. That is, it was only collected at one time point, so we don't know what's sort of preceding the other here. But that would be my best guess, and we're collecting more data, and we'll see if the phenomenon replicates itself. Now, again, I mentioned that these young children, they cannot describe what's going on in their own sensory experience, whereas most autistic adults can do that, and also ADHD adults, of course. So this other study that's got ADHD adults, autistic adults, and ADHD adults, autistic and ADHD, and collected a sound tolerance measure, the multidimensional inventory of sound tolerance, and that's got scales for loudness, hyperacusis, misophonia, and pain hyperacusis, to name 3 of them. And you can see here that in all of our groups, I don't know why we also saw the relationships in the in the comparison group, but you can see that it's related to, in this case, hypervigilance. If you've got more of this pattern of hyperacusis or misophonia, you're more likely to show hypervigilance. We saw similar things with hyperfocus, with inattention, as well as with anxiety. Even pain hyperacusis, which, like I said, surprised me a little. I didn't necessarily think that this could be related to, or certainly not caused by the attention, but possibly people were using pain as a metaphor for other kinds of sensory distress because our vocabulary to describe them is so poor, as I've been saying all along, or possibly it's also possible that maybe it intensifies the experience without actually being directly responsible for it. Who knows? Regardless, we've got all these things that are related to each other. And again, there's only a single time point, so we don't necessarily know what causes what. I will show you this overly complicated thing, but be aware that this is a bit of a castle in the sky. This is just showing that these things are related. It's not necessarily showing what causes what. That being said, we're seeing that people who have more of this inattentive pattern and more hyperfocus, which are related to each other. People with either more of either or both of those are showing more sound intolerance, and we did an analysis that sort of combines some of the common variants in the sound intolerance, because a lot of the people who had misophonia also had hyperacusis, so much so that there's just sort of a common sound intolerance dimension that was driving a lot of this. So we pulled that out, and the attention was related to that. So potentially the attention differences make people more likely to have some of these sound intolerance experiences in the first place. But this was then related to anxiety. So again, just speculating in an informed way here, but if you got this sound intolerance experience, it would be reasonable to get anxious, right? Because you're then going to want to avoid that experience in the future. You don't want that to recur. It was, aversive and uncomfortable and distressing. But if you're anxious about it, you're going to be hypervigilant. You're going to be scanning your environment for a potential threat so that you can avoid it. This is a great strategy if, for example, you want to avoid getting bitten by a snake in an environment where you're likely to see snakes that might bite you. It is less effective if the threatening thing is actually a sensory stimulus itself, because then it is more likely that you will notice and pay attention to that sensory stimulus. And indeed, we saw that more hypervigilance was related to worsening, a sensory responsiveness. So again, we don't know the order of these things causally for sure, but it does raise the possibility that you could sort of see a bit of a vicious spiral here where, increasing sound intolerance, leads to anxiety and hypervigilance in a way that could be quite aversive. So that's then creates a tricky balance because, of course, if you completely avoid sounds, that could be bad as well and lead to some, sort of oversensitization of your system. So how are you going to navigate between, these two dangers of, too much avoidance versus, too much, burdening yourself and causing yourself to burn out and go through this, nasty, horrible sound intolerance to hypervigilance spiral, which again, I'm, just speculating about the directionality here based on, um, other research and, my own experience and, what seems plausible. So that's tricky. I will also mention very briefly here that we also saw that these patterns of hyperfocus were related to one other thing, which was rumination, negative repetitive thinking. Now, of course, neurodivergent people are going to be experiencing often, sadly, discrimination or exclusion or, other factors that lead to, what you might consider sort of minority stress, the additional, stress and difficulty that you have to deal with because of being part of a marginalized minority group. But, and that could have its own impacts on mental health. But, having this hyper-focused style where you're then ruminating, you get stuck in these, loops of concern, some people in the community call them, about, negative things, then that could be bad and further contributing to poor mental health, such as depression, which was related as well to hyperfocus. So this is all sounding like hyperfocus is really bad. Before I finish, I do want to emphasize that it is not, however, all bad. Yes, in our data, we did see in that adult study that people with more hyperfocus tended to have poorer quality of life. There's a negative and inverse association where if you have more hyperfocused, you tend to have poorer quality of life. Not sounding so great, but bear with me. If you have this experience of hyperfocus, you're also more likely to have positive experiences of hyperfocus. Creativity, enjoyment, productivity. There's actually, some really eloquent writing from Julia Bascom, who is, an autistic advocate and very prominent at the Autistic Self-Advocacy Network in the United States. And Bascom writes about the obsessive joy of autism. That's the term. This, wonderful experience of, flow and intense engagement and joyfulness that can come from this immersion in the more positive experiences. And so people who have more positive hyperfocus, more, getting more things done, more creativity, more enjoyment, they were having better quality of life. So there was also this positive relationship with quality of life as well. And the fact that you can see both this negative as well as this positive, it's just another one of those paradoxes. The hyper, sensory responsiveness, the hyper focus, the inattention, and now the positive and the negative quality of life impacts. And, all of those, I think, really emphasize how much everything varies, from moment to moment in, a way that is really reflecting the, the environment, the specific context that somebody's in, it could lead to a very different, result from the same sort of neurocognitive thing, which emphasizes the importance of making sure that our environments are suitable for neurodivergent needs, that people are not being needlessly or pointlessly sent into a spiral of sensory distress, that people's environments are enabling and inclusive and welcoming of differences. So to recap everything I've been saying very briefly, it does seem quite possible based on these data that attention might be involved in these sensory reactions. At least in maintaining or exacerbating the sensory reactions, and possibly also in some cases contributing to their causation in the first place. But I'm sure there are multiple mechanisms. I'm sure there's multiple things driving all of this. And of course, we do need longitudinal evidence. What I've presented to you today are associations at a single point in time. So, anything I say about the causality is, of course, just informed speculation and guesswork. We do need to better understand also individual differences in all of these things. But also how all of this is shaped by, people's context, the environments around people, differences in what's going on from one moment to the next, where you can see, all of these seemingly, contradictory and paradoxical patterns. And ultimately, if we're going to be able to understand our own experiences and feel that, sense of control, that I at least understand what's going on and can begin to try and figure out how to cope with it better, let alone to try and, convey that to other people and advocate and seek validation and accommodations. We do need the conceptual frameworks to understand all of this. And that is still very much a work in progress, but, hopefully something where we will be able to, improve everything. Easier said than done, but important. So to conclude, thank you all for your interest in this. Hopefully you got something interesting out of it. Thank you as well, of course, to our participants for their time to make this research possible as well, who contributed to these studies. I mentioned some of this was my PhD data, so particular thank you to Susan Rivera and Cliff Sarin, who supervised my PhD, and of course, all of the funders who made this work possible.
That's amazing. Thank you, Patrick. What are your next steps then? What are you working on something in relation to this at the moment?
Yeah, I'm continuing to, explore the attentional aspect of things and try and, figure out some more of what's going on there, the conceptual frameworks for understanding the attention. I'm also really interested in diving into the real world, what's happening to people in these real contexts. And so there's methods which, rely on sort of smartphone apps which we call ecological momentary assessment, or the experience sampling method. And people can just go through their days and report, what's happening to them on a day-to-day basis. And it is somewhat tricky to use for sensory reactions because, of course, if you're in a state of sensory overwhelm, you're not necessarily going to be up to, filling out a questionnaire about that in that moment. And it might happen at any moment. So if we ask you to fill out a questionnaire, we wouldn't even necessarily get you at the right moment. But we've been doing some co-design and working with people in the community to try and figure out the best way of getting that information in a non-burdensome manner.
It's really difficult, isn't it? That's one of the challenges that we have when we're doing treatment with patients with sound sensitivity, is remembering in that moment when you're possibly overstimulated and dealing with a lot of emotions and possibly pain, to consciously think, I need to be using the skills that I've learned. And that's obviously the same problem that you're experiencing, going, right, okay, I need to consciously think, I need to be documenting this. So it is a challenge. Do you feel
also
that
also an ethical issue too, because focusing on like an actual, strategy that might help you cope with that experience is rather different from like providing information to some researchers who hope that maybe someday that will be helpful to somebody else.
But I think, like yourself, there are so many people who are experiencing these problems who want to use their experiences to help others, which is amazing. Do you feel
Mhm.
that this information can be used in environments to help the neurodivergent population, like in schools, and to be able to provide them with a comfortable environment for them to be able to learn?
Mhm. Yeah, I don't know that the attentional evidence is quite as relevant to environmental adaptation. For example, some of what we're uh, you know, some of those things where you're trying to get into the real world might be more relevant there. And there's a lot of tricky sort of considerations, like if you're going to create a sensory, escape area. A lot of the time people do things that are really not constructive, like putting it in some place where nobody knows where it is, and it's not signposted. So if you're having an experience of sensory distress in a public space, you could be totally ignorant of the fact that 50 meters that way, there's a sensory room that you could retreat to. So that's not great. Or people design the sensory rooms in a way that is not as good as would be ideal. And so that's a different line of research, and there's great work that is being done on that. Katie Unwin, a colleague at La Trobe, has been doing some of that research. Um, I think the attention research is relevant for other areas, like you mentioned, the idea of sort of, coping strategies and skills in the moment. If it is the case that attention is contributing to some of these things, then I hope that that could be helpful to people in the moment. Of course, volitional control of attention is tricky, but I do, find that um, whether it's some illusory benefit from thinking that I know what's going on, or that I actually know that this is affecting my own experience, I do feel that understanding that helps me cope with some of these things. So and so yeah, I think there's a lot of different directions that one can take to try and get at this from different angles.
You raise an interesting point there about the attention being able to use coping strategies. If somebody is hyper focused in that situation, are they going to be able to shift the focus to the coping strategies that they're hopefully learning, to be able to use those to move past um, that negative experience that they're currently doing? So that's really interesting. And a large population of the patients that I see are neurodiverse. The benefit of the work that we do is that it's all patient focused. So we do try to aim it on the individual, and how best do they learn, how best do
Hmm.
they take in information.
Right.
Um, but regardless of that, obviously the research that you're doing has a huge impacting factor, because if the evidence shows that they're not able to do this, it's how can we move them into a place that, or what can we do to help encourage them or change their attention focus, if that's a possibility, so that they can use the coping strategies that they're hopefully learning.
Yeah, it's really, really tricky, and hopefully even just the awareness that that's going on, if it is indeed going on, could be the first step towards that, towards figuring out, okay, that then tells us what needs to be done. I remember that there's some cognitive behavior therapy studies with misophonia from Jaeger et al. I guess it was. I hope I'm pronouncing that correctly. And they found that the participants in their studies were actually finding attention reorienting to be a helpful strategy. So
It's really interesting, and it's a lot of a lot of the patients, obviously we see a lot of young patients who are struggling with misophonia and hyperacusis. And a lot of the population of patients that we're seeing um, are neurodivergent and maybe haven't, because in the UK our systems may be slightly different, maybe aren't on the pathway yet for diagnosis or having support from institutions that they need to. So they're seeking help for sort of elements that they can do. So in regards to like sound sensitivities, and so there's a lot going on with these, patients, and a lot of them are quite young as well. So having the research that you're doing is really important for people like myself to be able to understand what's going on with these patients and how best we can help them. Yeah, thank you for that. It's been really interesting. What with the work, the next work that you're doing with this app, I spoke to somebody recently on one of our other videos. They were doing misophonia, and they're working with an app to try and sort of track different environments and how patients are um how they're coping. Do you feel will this be recording, like the app, is it recording just a patient response, or do you also sort of like record different environments as well?
Well, the pilot work we have done so far has been focused more on just getting the individual responses, but I have, asked for funding. We'll see if I get funding, but I have asked for funding to, sort of scale that up and actually try and capture, some of the sensory stimulation itself, as you say, because the technology does exist now where this is something that can be done, where you can actually capture sensory stimulation that is affecting people in the real context as they're going through the real world, and that is a really exciting opportunity.
I actually have some patients as well who are using some of these apps designed for sound sensitivity or hyperacusis, where they log in and they can see real world environments. Whether these, one restaurant is slightly louder to another restaurant.
Yes, yes, like
And
Soundpoint, or what is it? Soundpoint, yeah,
yeah,
something like that.
Amplifon have one sort of in Europe. I know America has a different one. One of my American patients is using this app, and she finds it really helpful because, as you said, the safety seeking behavior of avoidance of different stimuli can obviously have a negative effect on patients. In that they're lowering their tolerance levels. So actually, if we can find a way that patients can socialize in the way that they want to, but in a way that they feel safe and comfortable,
Mhm.
it is really important. I
Yeah,
hope
and
you
if
don't mind. Oh, go on. Sorry.
I was just going to comment there as well that, control is such a big part of it as well, and safety, um, in the autism field, we spend a lot, we're, very much interested in predictability, but, even beyond that, the question of being able to control things and escape from things if you need to. If you know that you're in an overstimulating environment, but 10 meters away, there is a sensory, room that you could escape to if you need to and de-stress, then you don't have to worry about that. Because, in addition to trying to like let's imagine you're in some like social situation at a restaurant. First of all, you're trying to deal with all the intense difficulty of coordinating like a social interaction in a group setting at that, with needing to monitor multiple people and figure out when to jump in and plan your next utterance, and maybe doing some like masking and camouflaging of autistic traits and behaviors, which is its own thing, and you're doing all of this in the real world, and you're trying to cope with some negative distressing sensory input, and you're sort of metacognitively worrying to yourself, how bad is the sensory input? Do I need to run away and escape this situation entirely? Do I need to just stay here and suck it up for some reason because I don't know, it's like career relevant or something? And if you're doing all of that worrying in addition to the other stuff, your coping resources are going to be really limited. And if you can cut out some of that, metacognitive worrying by just knowing that you have a safe area that you can retreat to for a bit if needed, it makes it then so much easier to participate in that situation.
Definitely. And like you said, it actually is so much more for neurodivergent population. It's so much more than just a sound sensitivity, because obviously some of the patients that I'm seeing, it is just sound sensitivity. But as you said, there's everything else going on in that situation that is, is overstimulating for you.
Mm.
So it's bearing in mind. And I suppose that is the reason why sometimes our patients find it so difficult to be able to cognitively go, right, I need to, this is the coping strategies that I've been given, I need to use these. But actually when you have, your brain is doing so many other things in that moment to just keep you grounded, it's really difficult to be able to call on um those strategies. Do you, hope you don't mind me asking, do you find sound sensitivity is an issue for you when you're in those types of environments?
Yeah, and I honestly do a lot of avoidance of those environments. Um, and on the whole, for me, I feel like uh, the solution has been to sort of cut out the unnecessary things, right? Because there's so many things in our society that turn out to just be, unnecessary, where people are sort of burdening, themselves with things because it's like socially normative or expected, but actually turns out to be not useful. And then you save your coping resources for what's important. Now, I'm in a very privileged situation right now because I work at an autism research center and a neurodiversity affirming one where there's, lots of other neurodivergent staff. As well as neurodivergent students, and there's just sort of an understanding of these things. And I, have a job that allows me to work from home too when I want to. And so that means that, when I do really have to like go into an overstimulating situation, like a conference or something, I have a lot of coping resources saved up. I tend to have a lot of control over the environments that I'm in, and so that provides a lot more of it. So honestly, these days, a lot of the sensory and sound intolerance issues are so much better for me than, for example, when I was in middle school when they were atrociously horrible. So I think that, I mean, sure, there may be some like developmental maturation things as well, but I do think it's a hopeful story as well about the capacity for societal changes in the environments that people are in to actually um, not only make it so that people can participate more effectively, but that they can actually have even more coping resources to participate in uncomfortable situations when they do arise. And I'm not retreating to the extent that I'm like never exposing myself to the things. I'm just saving it for when it's important.
Excellent. And that's what's really important, isn't it? And you've got more autonomy over those decisions. Like you said, when, we've got children in school, you have a
Hmm.
strict routine that they might have to adhere to, and it's
Yeah,
harder for them, there's less control.
yeah,
Um, it's really important, actually, what you're discussing there is that because it's not just for sound sensitivity. A lot of my tinnitus patients struggle with that unnecessary noise that you discussed, that when you go into a shopping center and the music is
yes.
overwhelmingly loud, that can
Yeah, why do people feel the need to play loud music in public spaces? Like, does it really make the experience that much better for the people who aren't bothered by it?
but
And we know that it, can make it much worse for a subset of people. I don't get it. Why? Why?
And when you think about the population of people who would be distressed by that environment, we've got sound sensitivities. It's going to trigger a lot of tinnitus patients. Here, patients with hearing loss are going to
Mhm.
struggle more in those environments. What is the benefit? What
Yeah,
population of people are benefiting from having these overwhelming, loud, the music? And
yeah.
part of what we discuss, with as an audiologist, from my audiology hat on, when we're talking to patients with hearing loss, whom are needing help with their hearing aids, or just if they've decided not to have hearing aids. Communication strategies are about looking at things like, okay, look at sitting away from speakers or where music is playing, or loud groups, or if you're in a restaurant near the kitchen, because we're trying to take away that unnecessary noise, that the sounds that are going to hinder somebody from hearing as well. But actually all of those unnecessary sounds are overstimulating for quite a large amount of the population. So it is hard, isn't it? And I'm hoping that at least sort of the school environments and colleges and universities are starting to take a lot of this information on. Hopefully that will spread out into the greater populations as we're becoming more and more aware of protecting our hearing. And I spoke recently in another video about how actually this is becoming a little bit more it's becoming into the population. Like Loop are advertising, have got affiliations with Coachella and Formula One, so they're actually advertising, oh actually okay, these are these are really great environments, these are places that people want to go to, but realistically actually it could be damaging or uncomfortable for a lot of people. And so this might be a way of helping you enjoy this situation. So I'm hoping that, as people are becoming much more aware, and I think actually the younger generations are actually happier to accept these, things. They're not seen as not cool, or we're all happy to protect ourselves in a way that other generations weren't. So hopefully this will spread out into larger populations.
Yeah. I mean, I, so much, insight as well, with young people who are just, unashamedly, frankly, able to, discuss and understand even their needs, and advocate for them in a way that, I mean, I'm only like 31. I'm not old, but even back when I was growing up, I'm making myself sound old. We would not have done that,
No.
not nearly to the same extent. So I am very hopeful about that, cultural shift, as you say.
Yeah, you're completely right. Thank you so much, Patrick. Was there anything else that you wanted to add at all?
Yeah, I think we have covered a lot of ground. So once again, thank you so much. Really wonderful to talk to you.
I really appreciate you taking the time out and joining us all the way from Australia. Um, Please take a look at the HISHIR International website for our latest events, including the International Conference on Pharmacology and Gene Therapy for Tinnitus. This is a virtual event on the 2nd of October. Starts at 1:45 to 5:30 UK time. Registration closes on the 15th of September. This program brings together world-leading experts and emerging voices in auditory, neuroscience, pharmacology, genetics, and translational therapy, and is open to healthcare professionals, researchers, and the public. Thank you, everyone, for joining us, and we will see you next month. Excellent. Thank you so much, Patrick, for joining me. I'm really, really appreciate it. That was so interesting. It's so the amount of patients that I see who are neurodiverse, and I'm always looking for ways that I can help and encourage and support them. Having all of this extra information is so helpful, and it's also something that I can then pass on to my colleagues as well, because I work for the National Health Service as well as
Oh
HISHIR
yeah.
International. So it's really, to be able to pass this through people makes such a difference. So thank you so much for joining me today.
No, thanks for the invitation. I feel like we always stay in our little bubbles, and so whenever we're exposed to information in this lovely interdisciplinary way. So yeah, I'm so glad to hear that it was useful to you, and thank you for inviting me to do it. Yeah.
Thank you so much. I hope you enjoy the rest of your evening.
Yeah, and yeah, same to you, except like your whole day. And yeah, I hope you're
I
fully recovered, as I said, soon. Yeah.
thank you. Yeah, I'm feeling much better now. Thank you so much. I'll speak to you soon.